I'm Aaron Koepper. I'm a news editor with The Breeze. I'm here with Joanne Grossi, the regional director for the Department of Health and Human Services. I'm talking to her today about the effects of the Affordable Health Care Act, passed by President Barack Obama in 2009, and health challenges that college students face. One of the most recent changes is that birth control is now free to anyone with a plan without copay. How might a college student take advantage of that?
Yeah, thanks for that question, Aaron. In fact, free preventive services for women, not just birth control, but free preventive services for women became effective. They'll become effective in September of 2012. It just got included into the Affordable Care Act, but it doesn't actually take effect until September 2012. But it's not just birth control. So from now on, women will be mandated to be able to get for free mammograms, pap tests, birth control, STD screening and treatment, domestic violence screening and treatment, and HIV screening and treatment.
Right. Also, anyone who's under 26 can now be covered by their parents' plan. How does that work?
Yeah, that's great. That started September 23rd of last year, so any young adult up to the age of 26 can remain on their parents' plan. And so the good news for the parents is that your child does not have to be your dependent, does not have to live with you. They can even be married. But again, they get to stay on your plan to the age of 26. And again, the college age population, recent graduates, are the exact people we had in mind. We know how hard it is to get that first job and to get insurance with that first job. So that became effective September 23rd.
What would you say is the biggest health challenge for students on campus today?
I think there's a couple of them. Certainly that freshman 15 is a very popular issue, and it really is true. I mean, I can't stress enough that being overweight has really become the number one health challenge for both children and young adults. In fact, the CDC just released a report this week showing that strokes, of all things, among 18 to 34-year-olds have gone up 33%. And the direct association of the strokes is because they're overweight.
You hear talk of a lot of college students pulling all-nighters. None of us sleep enough. I mean, how does someone reconcile that?
I just think it's about, discipline and understanding that getting enough sleep certainly is a very important issue. In fact, data came out this week showing that people who don't get enough sleep are much more likely to abuse drug and alcohol.
Right. You talked about dating violence as being a huge problem. I feel like a lot of people kind of don't know it when it happens to them or don't understand how it's like a serious problem to their lives. What would you suggest, what resources would you suggest people go to kind of get a better handle on that?
The state and both the federal government always provide funding to have domestic violence programs, which include teen dating violence. On all the college campuses, you have a student health office here, and I would encourage people to get involved in it. And in fact, Vice President Biden next month is holding a roundtable on teen dating violence. And we'll be holding one in each region of Department of Health and Human Services all throughout the country, and we're looking for input. It's a focus on men, actually, so we're looking at teen dating violence in men and the role that men play in this issue. So I really would encourage anybody who's interested to find out about the roundtable being held in this area and getting involved, because it really is an important issue.